Welcome to Longview, Texas. We are part of the Texas Accountable Communities for Health Initiative. We're one of 6 projects, and our project is focused on high utilizers of the 911 system, that being police and fire services along with the emergency departments. And we are focusing on the most vulnerable in our community and looking at their non-medical health drivers and seeing if we can connect them to the resources that we have.
As an ER physician, I see people that have a need, and it's very difficult oftentimes to say, is this a social need or is this a medical need? And really they intertwine many times. So there's one example of a patient needed dialysis, but they couldn't get out of their house. And so they were calling Longview Fire to come assist them out of the house, into the vehicle, to go to dialysis, and then we would reverse that process. So if you do that, 2 times a day, 3 times a week, it starts to add up. They don't really have a medical need, but they're calling us anyway. So if we can go to the source of their need and we can fix that through the collaboration with all of our partners, then we provide them something that they actually need, and we can take some of the pressure off of our system by actually just meeting them at their point of need.
GLOW is Greater Longview Optimal Wellness. We have a steering committee team made up of all 8 partners.
The mission of GLOW is to positively impact the health of Longview and the surrounding areas.
We wanted to wrap around an individual in every way, not just a medical way, but in a mental, social, physical way.
When we first were approached to be part of GLOW, my first reaction was, that's not really in our sphere of influence, because I was still operating on the model of medical things were for medical people, non-medical things were non-medical people. And when I first got asked to bring Greater Longview United Way onto the GLOW project, I really had to have some education on how these non-medical drivers of health were in our wheelhouse and how we can connect people to those services and programs in our community. Once we got the ball rolling, we were all in it 100%. Our role in the GLOW project is to be a resource hub for our partners on the GLOW team. So we operate a resource line that GLOW partners call, and we connect them with other nonprofits and programs in the area that focus on food and rent and prescription assistance, mental health counseling, and a whole host of other programs and services to help people get where they need to go and get back on their feet.
Whether we are out at a camp in the woods or behind a building, rather than loading them up in my car, going to the hospital, or calling EMS, I can actually just call GLOW. I keep using the term game changer. It really is a game changer for those that need this type of service.
Before GLOW got started, everybody was trying to do their own thing, trying to meet the needs on their own, but they didn't have the skill set or the resources or the knowledge base to make that a full, complete connection. Now, people are more aware of our nonprofit partners, of our care partners, that we're able to connect those dots for people and really show and highlight the caring power of our community and get people to where they need to be. And what's great about GLOW is that a lot of our GLOW partners are learning about programs that have been here for decades that they never knew existed.
To me, it's collaboration of everybody that's been involved. If all those other 15 people I tell you about, they're all from, whether it be from the hospital, from the city, from the county, from our state authority of mental health. It's getting all those people together to collaborate that there's a better way. There is a better way.
Longview is just one of 6 TACHI sites across Texas. Episcopal Health Foundation created TACHI, and we've invested over $8 million in startup funding to really catalyze community-driven solutions to address non-medical drivers of health across Texas.
The work of TACHI provides a structure for changing how a community creates conditions for health and how power can be shared.
Each site is addressing the unique non-medical needs in their community, but what's central to them all is a focus on health equity. And that's that everyone in every community has a just and fair opportunity to live their healthiest lives, no matter who they are, where they live, or how much money they make.
I think when you first start a new program, change is hard. System change is hard. Educating people about what you're doing is hard. And giving credit to the project when they have successes. Because I think stories tell the project. If I explain to you the project, you're like, oh, okay, that's a great project. But when you see a story, then you understand how it really changes your community. So as our partners have worked on cases, the light bulbs just kind of start coming on. Oh, we can do this different. Oh, we can do it better. Oh, we can team up and actually do something better. And I think that transition in our community is just slowly taking place, and we're starting to see new partnerships and new relationships built between the agencies where we can do things differently.